Yeah. So, Excellencies, Honorable Ministers, colleagues, ladies and gentlemen, I would like to begin by expressing my sincere appreciation to the Government of Bangladesh, the partners in population development, and of course UNFPA, for hosting this very timely and important 21st International Inter-Ministerial Conference on South-South and Triangular Cooperation in Population Development. And it is with great privilege and responsibility that we gather here today to discuss the critical importance of South-South and Triangular Cooperation in achieving the objectives of the International Conference on Population and Development at its 30th anniversary and in advancing the Sustainable Development Goals. As we convene in Dhaka, a city of dynamism and resilience, we are reminded of the imperative to forge partnerships that transcend borders and empower nations to build sustainable futures for all. As you can see on the slide, this particular presentation is more of how do you institutionalize South-South cooperation in the national development strategies and benefits to achieve the ICPD 30. I have purposefully converted this particular address into a PowerPoint presentation with the objective that whatever I discuss over here makes an indelible impression on your mind so that you can go through it, ruminate over it, and give us feedbacks. How do we improve it? Because this is one of the tasks assigned to me as a consultant for getting this work done for PPD so as to benefit the whole of the PPD member countries. So this is the background of the South-South cooperation. And here you are seeing that the South-South cooperation has emerged as a powerful instrument for development rooted in solidarity and mutual respect among countries of the South. And it's a framework which nations exchange knowledge, expertise, and resources to tackle shared challenges and promote inclusive development. From Bangladesh to Benin, from Ivory Coast to Indonesia, and from Tunisia to Thailand, countries are increasingly leveraging unique experiences and innovations to drive progress in health, education, gender, and beyond. In the context of the ICPD, South-South cooperation offers a pathway to strengthen health systems, expand access to reproductive health services, and empower women and girls. By sharing the best practices and lessons learned, countries can accelerate the implementation of comprehensive sexuality education, improve maternal health outcomes, and ensure universal access to family planning services. So this cooperation is not merely transactional, it is transformative, fostering sustainable solutions that resonate across borders and generations. So what does actually institutionalizing mean for all of us over here? It means that we develop strategies and responsive policies towards addressing the current and future needs. For example, we need to incorporate the sexual and reproductive health into national adaptive plans for climate, development of strategies towards inclusive development, knowledge and technology transfers is one of the strongest pillars, building ownership. Governments are ultimately responsible for their own development, and government ownership of development progress ensures that efforts will be targeted towards ensuring desired outcomes with the support of policies and institutions and earmarked budgets. So promoting cross-learning and provide mentorship to move ahead on this path. So this was basically the South-South cooperation which originated in the BAPA declaration way back in 1978, evolved in BAPA plus 40 years down the line. So South-South cooperation is a broad framework for collaboration about countries of the South. And what does it bring to us? It brings solidarity, it brings self-resilience, and also sustainable and equitable economic growth. So what are the potentials of the South-South cooperation? Why are you standing here? Why are you working here or meeting here as a group? What are the potentials of this South-South cooperation? It actually galvanizes political will, accelerates implementation of the 2030 agenda, employs innovative forms of knowledge exchange, promotes technology transfer, and then builds emergency response. Currently, you will be glad to know that 3 of the SDGs actually talk about South-South cooperation. So target 7.3, 7.6, and 7.9. It talks about additional financial resources. It talks about North-South, South-South, and triangular and regional cooperation. And it talks about international support for implementing effective and targeted capacity building. So what I'm trying to impress over here is that in SDG itself, South-South cooperation has been very boldly written and clearly has come out as one of the initiatives to achieve the goals under SDG. So what are the justification for South-South cooperation? So if you see integration of South-South cooperation and population dynamics into policy and development planning in PPD member countries, it actually, the reason is, the justification is that we as a bloc actually contribute more than 60% of the world population. And whatever we do, it has a significant impact on the global indicators, including SDGs. It emphasizes education and empowerment, particularly for youth. It promotes gender equity and women's empowerment, as it has direct implication for population dynamics, influencing family sizes, maternal health, and overall community well-being. It manages migration patterns and urbanization, incorporates environmental considerations and poverty reduction, and addresses global health challenges, including pandemics and infectious diseases. And how do you want to do this South cooperation institutionalization? Because it embraces use of national systems, capacity, and demand-driven approaches within the country and inter-country. It offers complementarity of capacities. So if I have some capacity in one area of work, I replicate it to your country so that we gain together as a bloc. Then it shares relevant solutions among partners facing common challenges. It accelerates progress towards SDGs, supplements efforts to have voluntary national reviews, and offers a flexible approach for PPD member countries. All of us know that it is a very onerous exercise to actually develop national health strategies. All of us know it's very complex and a dynamic process because it requires a balanced, coherent approach to improve the use of resources for health. Resources are always limited and our ambitions are always high. And how do we balance it is really the trick that we need to see and find out. It aims to move towards long-term sustainable developments and goes beyond the boundaries of health systems. It addresses the social determinants of health and the interaction between the health and other sectors. Coming to the challenges, now that we've lined up all the things that we want to do, what are the challenges we are facing as a bloc, as a PPD member countries? Because we have varied priorities in all of our countries. Every country are at different level of development, different level of resource, different level of capacity. So it's varied priorities for individual member countries. The outcomes of various relevant South-South cooperation activities, including workshops, are not integrated, therefore not taken advantage of. What I'm meaning over here is that we have convened here today, whatever decisions we take here, we forget it till we have the next meeting. And that is something what we need to do, have a continuity so as to really gain from the conclaves like that, that we are convening here. Then there is weak internal coordination in systematically strengthening the South-South cooperation. So we talk about South-South cooperation. When we go back home, we forget about it. We do not have any structure to support this system. Then there is insufficient follow-up of South-South cooperation activities. This is also a very deficient area. And the most important, if not the least, is the depleted funding. We are facing this as PPD. Our funding is getting reduced, yet the type of activities that we want to do, we are not able to do. So what are the potential areas for South-South cooperation? We have knowledge exchange, we can have knowledge exchange platform, we can have technical exchanges through deployment of experts, technology transfer, training, capacity development, joint research, collaborative strategies, investment agreements and resource mobilization, and infrastructure and development. So these are some of the modalities for South-South cooperation. We can have within our bloc bilateral assistance. We can have a regional cooperation agreement, for example, say South Asia or Central Africa or South Africa, intergovernmental institutional organizations, then civil society or to public health networks. These are the various avenues that we have, the modalities for South-South cooperation. And how do you plan to do that? So we have a methodology which has been thought about, and the methodology is actually three types. One is detailed desk review, second is stakeholder mapping, third is learning from the best practices. So on the detailed desk review over here in this particular slide, what we want to do or achieve is that to have policy and program mapping of PPD member countries and development of policy program review framework that we will develop, and we will measure every country on that. assessment of the policy program based on the strengths and weaknesses, and detailed review of the existing health policies programs of the PPD member countries, stakeholder mapping for each policy and program in the countries, and then comparative mapping and review of the governance, regulatory, and administrative structures in the country. I can tell you this is a very onerous and very, very tedious job, but then if you really want to achieve something substantial, we have to follow this process to get to what we want to. So this is to assess the institutional framework and capacities within the relevant health agencies of the South-South cooperation implementation. And review will also take into account the policy-making process, involvement of stakeholders, systemic linkages with global evidences, and accountability measures. So methodology 2 is second, as I mentioned, was the stakeholder consultation. This is one of the most important part of this review. Will be development of a tool for conducting stakeholder consultation, conduct the consultation with the key stakeholders in every country, including government officials, health professionals, civil society organizations, and international partners, to gather input and ensure alignment with national health priorities. So it's envisaged to formulate a standard review questionnaire, which we are developing right now. The qualitative analysis will be on an Excel-based tool, and the sample size for the stakeholder consultation will be based on the consensus and in discussion with the PPD officials. And the third proposed activity that we need to do is consolidating the best practices, devising the roadmap, and capacity building. This is very important because we need to develop a strategic framework for documenting best practices, the mapping of the best practices, consolidating the findings and documentation, consolidating the learnings from the findings gathered by the desk review and stakeholder consultation, and finally devising a roadmap and recommendation for individual countries that we are going to review over the course of the next year. Finally, when we come out with a result and an outcome, we will just not stop at that. We will conduct orientation of most of the countries, not only with their government representatives, but also with their non-government representatives, orient them on how to really work in this particular area of South-South cooperation, helping them, assisting them so that it does not remain within the confines of the Ministry of Health at the top echelons, but it goes down below where it really matters. The selection and documentation of best practices will follow the WHO guidelines. So coming to the last 2-3 slides, this process of institutionalizing South-South cooperation, once we are done with it, what we need to do is first establishing institutional mechanisms where we will urge upon every country to really set up a national task force for South-South cooperation. That has to be within the ministry or wherever its decision is left to your government. Then identifying the priority areas, categorizing priority areas that are of common interest, and deciphering the probable solutions and modality of the South-South cooperation. Second, really most important is the development of the tools, such as manuals, protocols, performance indicators, and reporting mechanisms. Third would be aligning policy priorities. For example, when we are talking about gender equality, it has to be embedded in the National Adaptation Plan on Climate. And fourth is the regular meetings and interaction and follow-up. So it cannot be just one-off meeting like 1 or 2 like this. It has to be meetings of regular meetings and follow-up has to be done on the aims, on the objectives, so that at least we reach the point that we are aiming for. So this is an ambitious timeline that I have developed over the course of the next 12 months. So what are the things that we are going to do? The activity on the left-hand side, one after the other, which talks about the inception report, which has already been done and delivered, desk review of policy mapping, the stakeholder mapping, the interviews, listing of documented best practices, data analysis, capacity building, and then preparation and submission of report. Now, this is a one-year sort of a one-year exercise that we're going to do. I know it's extremely ambitious, but I think with support from the member governments as well as the funding, we will be able to reach at least half the countries of the PPD by the end of this particular year. So, for this, the support of countries and the PCCs and UNFPA is solicited. This is a request to all of you that we need to have your, because we will be using custom-made schedules to elicit information on policy, program priorities, current status and outcomes, because it will be the responsibility of your government to arrange a meeting with government policy makers, also meeting with development partners in your countries, also community representatives to get their feedback, and the caregivers to understand the bottleneck. And that's a request that we are putting it to all the PCCs of the countries. So we will accumulate all the data, or rather all the contact addresses, and be in touch with you on a regular basis to go upfront on this. In conclusion, the path to achieving the objectives of ICPD 30 and advancing the SDGs lies in our collective resolve to embrace South-South cooperation as indispensable tools for development, let us reaffirm our commitment on solidarity, partnership, and inclusive growth. Let us harness the power of collaboration to build resilient health systems, empower women and girls, and safeguard the rights and dignity of every individual. Together, we have the opportunity to shape a future where every person can thrive, where prosperity is shared, and where sustainable development is a reality for all. Let us seize this moment with courage and conviction, knowing that our actions today will define the world of tomorrow and contribute to the well-being of the people all over the world in a spirit of South-South cooperation under the overarching umbrella of Partnership for Population Development. Thanks for your listening.